All right, hi, Mark Adajar from XSculpt, and thanks for joining me on my, my Zoom Q&A today. And so we will be talking today about, basically gynecomastia and surgery. So I want to start at promptly at 1 o'clock, and it's 1:01 right now. So what I'm going to do is I'm going to talk about my ChestSculpt procedure, my postoperative protocol, and answer some of the most common questions that I get on Reddit, or some of the questions that are on Reddit that come along, and then if there's any questions that come in through the text or anything like that, I'll try to address those. I'm going to be posting this video on YouTube, because there's some people who ask that if they can't make the live chat, that I post this somewhere, and we'll go from there. And then hopefully, if this gets a good response, I'll do it again. Okay, so now again, I'm Mark Adajar. I'm one of the surgeons at XSculpt, and one of the procedures that we do is the ChestSculpt procedure, which is our most common, our most popular procedure, which is our gynecomastia correction procedure for grade 2 and grade 3, and some grade 4 stage gynecomastia. Now, basically the goal of ChestSculpt procedures 2 is basically, number 1, to take care of the gynecomastia itself, and number 2 is to make your chest look as good as possible by doing some high definition liposuction around the pectoralis muscle. Okay, so basically what that is so basically what I'm going to do is I'm going to go through the procedure from start to finish, and then talk about the postoperative protocol. Okay, so basically when we start, we start obviously at the surgical center. You get an IV, and the purpose of IV is for the anesthesia. We do our procedures and our deep sedation because our ChestSculpt procedure can be very uncomfortable, and we want you to be as comfortable as possible. So we do our procedures and our sedation. Now, when we go to the operating room, we start out our procedure by doing an incision about this big, about 3 millimeters, and we make an incision within the armpit, within the pectoral, like at the end of the deltoid pectoral groove, which is probably like right in here. Okay. After we make that incision, we start out by doing what we call tumescent, which is basically saline mixed with lidocaine and bicarbonate to numb up the entire chest. Okay, and we do that on both sides. We make an incision here, we make an incision here, and we numb up both sides really well. After we do that, we start out with what we call Vaser. Now, Vaser is a modality, like an energy modality, where it basically breaks up the fat using ultrasound technology. It uses heat and ultrasonic vibration. The advantages of using Vaser, if you've heard of Vaser, it makes the final result much smoother. The pain is much less. There's less incidence of bleeding. And so what we do is we pre-treat the fat with Vaser. So I start out by melting all the fat around the gland, the breast gland in the lower half, all around the breast gland, around the nipple, right here. Now, and that will help with the first part of our goal, is to take care of the gynecomastia. Now, we also want to make sure that your underlying chest looks as good as possible. So to enhance the borders of the underlying pectoralis muscle, I start to treat the chest wall underneath the muscle here, right underneath the border of the muscle here, underneath the pectoralis muscle here. I do in between the border of the pectoralis muscle here and the latissimus muscle here, I'll melt all the fat over here to try to get this skin to press against the chest wall to bring out the border of the muscle here. The fat at the armpit, I do a little bit of treating of the muscle here, the fat here behind the muscle. Also here at the deltoid pectoral groove, I'll treat the fat here to give it a little shoulder and chest separation, so that you'll get a little bit definition here. Now, after we treat all that fat with the Vaser, we have to suck out all the fat. And basically, I take the liposuction cannula, which is basically a long metal straw, and I suck out all the melted fat. Now, once that's done, all that's going to be left is just the breast gland. Now, to take out the breast gland, we make an incision on the areola, which is the border of the nipple. Now, on the right side, we make a incision on the right nipple. It's going to be if your nipple's a clock, the 9 o'clock to the 6 o'clock position, right on the border. Okay, you make a cut along that border, and I remove the gland from that incision. I remove 100% of the gland, the entire thing. And then I close those cuts with stitches that dissolve. I do the same thing with the other side. I pre-treat it, except on I suck out all the fat, and then except on the left areola border, if your nipple's a clock, it's going to be from the 3 o'clock to the 6 o'clock, and I remove the entire gland from this side. Okay, and then I close those cuts with stitches that dissolve. Now, when the patient wakes up, you wake up in the recovery room with a compression vest on, with some foam underneath that's pressing down. Okay, and then you go home within 30 minutes after the procedure. Okay, now that's basically the ChestSculpt procedure. Now after the procedure, you'll be sore. The day of surgery, you're not going to be that sore because you can be numb from the local anesthesia we use. You're not going to be that sore the day of surgery. It's going to be the next day that it's going to suck. It's going to be the next day and the day after that that's going to be difficult because you'll be sore on your chest, but especially on the ribs below here, and especially along the sides here, because we treat that, and because the Vaser does a little bit of skin tightening as well, so you're going to be very sore in these areas. And it's usually the first 2 or 3 days that are the worst, and then it starts to get better. You do get pain medication after the surgery that really helps with that. A lot of guys can use ibuprofen, but there is pain medication that you definitely will get that will help. You also get some anti-nausea medication to make sure that if you have nausea, which is one of the side effects of the pain medication, that also helps. Then you see me within 5 to 7 days after the surgery to make sure everything's healing okay. And then I see you at the 3-month mark, the 1-month mark, the 3-month mark, and the 6-month mark, just to make sure the healing is progressing as it should. However, I always want my patients to text me pictures at least every 2 weeks of their chest at several angles, and then at that time I make recommendations on how any tips and tricks along the way, so we can make your chest look even better. And obviously, if there's any questions, any problems, or any issues in between there, I have my guys text me pictures, or they come into the office and see me at any time. But usually we try to follow at least that protocol of pictures every 2 weeks, and actually coming to see me every month, 3 months, and 6 months, just to make sure everything is going well. Many of our patients are from out of town and obviously can't come back can't physically see me, so the pictures every 2 weeks is actually kind of critical. So at least for our out of town patients, every 2 weeks for several months to make sure everything is going well. Okay, so that's actually the surgery plan. Now the recovery, how the recovery works, or what you can expect for healing, works kind of like this. Your chest is going to look great the day of surgery. It's going to look good after the day of surgery. The day after surgery, it's not going to look good. That's when you're going to start to swell. Now the swelling phase is from the 2nd day of surgery all the way up to 2 weeks. And that's when your chest starts to swell up. That's a natural thing after swelling. And there's nothing we can do about that, because that's just the way that your body heals after surgery. It swells. And that's why it's very important that you wear this compression vest and foam 24/7 to take off, only to shower and to wash it. Because the more we could limit that swelling, the faster we get to your final result. All right. Now, after 2 weeks, we enter the healing phase, which is from 2 weeks to 3 months. The first 6 weeks, generally, you make scar tissue, and the second 6 weeks, you generally break down scar tissue. There's a lot of variables that go into that, but that's kind of in general. We want to do things in this period. We want to manipulate things so that we can we can make your chest look as good as possible. Okay, and so number one, you don't need the compression vest anymore because the swelling phase is over. But I ask guys to switch to a compression shirt, one size smaller than they normally wear, and that's mainly for your comfort, so that when you walk around and your skin jiggles, it doesn't hurt too much. Okay. Now I have my guys do massaging of the chest. Because after you're not going to have any gland left. It's only going to be skin and muscle. Now I have my guys do massaging because we don't want the nipple to stick to the underlying muscle. Because if it does, when you move your arm around, you can have some discomfort if the nipple sticks there, and it'll look a little weird. Number one, or number two, the skin incision or the nipple incision can cause like a little bit of a dent or like a imbricate, like a not a true indention. You can like cave in or something like that. It's not a big deal. If that happens, you would come down to my office. I basically would numb the incision up, and I would have to cut the scar tissue and suture the incision closed again. It's just that it's another healing period, which we'd like to avoid. So I have my guys massage their nipple around in big circles, 5 minutes before they go to bed, 5 minutes when they wake up, to prevent that scar tissue formation. We do that for 3 months because we make scar tissue at night. And also any areas that are hard, it helps a lot. So we do that, number one. Number two, to help with loose skin, I have my guys do 4 exercises, okay? Number one, incline chest pressing. Number two, pectoral flies. Okay, what that will do, the chest exercises, it helps pull the skin up and also towards the middle. And then what happens is that when the scar tissue forms, it helps the skin stick in those areas. Number 3, lateral pull downs or pull-ups. And number 4, rows, which will cause the skin to pull backward this way. And so when the scar tissue forms, you'll build the cut down here and tighten up here. Okay. After 2 weeks, it's going to be very hard for guys to touch their hands above their head. It's very difficult, and so it's also very important for range of motion. So I have my guys do those 4 exercises as much as possible, at least 2 to 3 times a week. A little bit, if you're used to exercising, a little more of a hypertrophy type training, a little bit on the heavier side. But if you're not used to exercising, as much as you can do, even if you could just do push-ups or even just like door hangs and just kind of do like some muscle contractions, anything you could do would be great for that skin contraction. And the third thing we do is supplements. I have a list of recommended supplements that I have my guys take, which really helps in the healing period. I have my guys do protein and collagen during the healing period, because when you do surgery, you traumatize the skin, and protein and collagen is really important for that healing, especially collagen because of skin tightening, because that's how skin tightens. It rebuilds the collagen. Then I do have my guys do vitamin A, C, and E for all the incisions, and it helps keep the quality of the scar tissue high. And I also have my guys do arginine, zinc, and turmeric, and it helps limit the swelling, and it also helps the scar tissue stay soft, because when you do your exercises and when you do your massaging, what happens is that the scar tissue stays soft and it molds to your specific anatomy. All guys are built a little bit differently. So when you do your massaging, when you do your exercises, that scar tissue forms in a certain way to your anatomy. Now, because sometimes if the scar tissue can form balls or little like nodules. It's not a big deal if that happens. The problem is it takes forever to go away. And by doing the supplements, you're doing the massaging, and you do these exercises, the scar tissue stays nice and flat and forms to your body. You get to the final result faster. And so if you're really good about your post-operative protocol, the majority of the healing, about 75-80% of the healing is done by the 3rd month, because the final phase is the skin contraction phase, which is the 3-month to 6-month mark, where your body's just basically tuning everything up. And that's where you really, a lot of, the skin contraction, like a little bit of the skin contraction happens, the final scar tissue breaks down and all that stuff. But, with the post-operative protocol that I have been used to and developed, majority of the healing is done by 3 months. But there is that final touch-up phase and that last phase. Like I said, around the surgery, you'll get medications. You'll have pain medication. You'll have a week of antibiotics, and then you'll have anti-nausea medication should you have some nausea. I also give my guys a course of tamoxifen before the surgery. Okay, so tamoxifen is peripheral estrogen blocker, right? So the reason why we got this problem, I had gynecomastia myself. I had it when I was 39. I had my surgery already. But the reason why we have this problem is because we had too much estrogen in our system. I've discovered by giving my patients tamoxifen before the surgery, what happens is that the breast gland shrinks. And also what happens is that the blood supply to the gland itself is not as prominent. So it helps allow me to remove a big gland through a small cut, number one. Number two, the incidence of bleeding after the surgery and bruising is much less. So it helps. And so we do that for a week or two right before the surgery, but you don't need it after the surgery. And so that's the medications that you'll get around the surgery, okay? Now, with all surgeries, there's risks, okay? And there are three things we specifically look out for in this surgery. Now, the first one is infection of any of the cuts. Anytime you make a cut on the skin, there's a risk of infection, and this is no different. Now, we take great lengths to prevent infections. You know, we use special chemicals on the skin before the surgery. We give you antibiotics during the surgery, and we give you a course of antibiotics after surgery. An infection of the skin has never happened to me, okay? But it's a potential. So if it does happen in any case, you know, your cuts could get red, they could get painful to touch, and in rare instances, they would have pus coming out of them. Should any of those happen, we basically give you a different antibiotic than the one that you received, and it takes care of it, okay? The second thing that we have to worry about is what we call seroma. A seroma is a fluid collection. When your body heals, it makes fluid and then it absorbs it. Now the fluid has all the healing cells contained with them. So your body makes fluid and it absorbs it. It makes fluid and it absorbs it. And that's what swelling is. It has all the healing fluid cells in there. And your body's really good at recycling it. Sometimes your body makes more fluid than it can absorb. Like in cases of large gland removals, your body will make more fluid than it can absorb, and it basically looks like your gynecomastia is back. Now, it's not dangerous, you know, but the problem is if you don't take care of it, it'll just stay there. Your body will wall it off and it'll just stay there. The treatment is an aspiration, which means that you would come down to my office. I basically numb up the skin, take a needle, poke it, and suck out the fluid. Sometimes I have to do it once, sometimes I have to do it a couple times, but we have to do it until your body is healed enough so it can take care of the recycling the fluid on its own. If you live out of town, I basically call the necessary equipment to your pharmacy, and I talk you through it over FaceTime or over video, and I help you do it online. It's a little scary the first time, but I walk you through it, and many guys after the first time can do it on their own easy because your skin is still numb, and so it's not an issue. Or I call in a numbing cream just in case. Or if you have a healthcare provider or someone in the medical field that's a friend of yours, they can help, and I talk them through it as well. Any of those, or if you're in Chicago or you live near Chicago, you drive down to see me or one of my partners, and we can take care of it. Whatever you feel most comfortable with, we can make happen, okay? And now the third and the most important thing is a hematoma. A hematoma is a blood collection under the skin, okay? So the day of surgery or the day after surgery, your chest is gonna be nice and flat, okay? And then all of a sudden, it's gonna expand in size, it'll be black and blue, it'll be painful, okay? That means something's bleeding on the inside, actively bleeding. That means, usually a blood vessel is actively bleeding, and that's something that we have to go back to the operating room for. Usually it means that we have to go back to the operating room, I have to open up the cut, find out what's bleeding, stop it, remove all the blood, and close the cut with stitches again. Now, again, it's never happened to me, but I've had to take care of other people's hematomas, so I know exactly what it's looked like, so I know exactly what has to be done. It'll be one of those situations where you'll either text me or call me, say, hey Mark, I think I have a hematoma. I'll say, send me a picture. I'll say, but yeah, that's a hematoma. I'm on my way to pick you up. I'll bring you to the surgical center and get it taken care of. Well, it'll be one of those situations. Now, because of that, and if it happens, it almost always happens within the first 48 hours of surgery. So because of that, if you're from out of town, we have a rule that you have to stay within Chicago driving area for 48 hours after surgery, because of that specific thing that we have to watch for, okay? Because my priority is your safety. First and foremost is your safety. My second priority is making your chest look awesome, but never change that order. So so that's why we have all our guys stay for at least 2 days to make sure that that's not going to be the situation. Because the last thing I want is for you to go home right away, then something happened to you, you know, if you live in like Indiana or California or Texas, and then you get a hematoma, then you go to the emergency room, and then a surgeon just, you know, cuts open your chest and it gets all it gets all messed up. But you know, it doesn't affect your long-term cosmetic result. However, your healing phase is longer because you're going to be bruised and you're going to be inflamed longer. Okay, but your long-term cosmetic result will not be affected. All right. So basically, that's the chest sculpt procedure that we do for grade 2 and grade 3, some grade 4s, and then that's our basic postoperative, my basic postoperative protocol. Now for grade 3s, we generally leave drains because there's a lot of volume that's removed. And so we generally leave drains for grade 3 gynecomastia. If you're not familiar with the grades, grade 3 gynecomastia usually is 500 cc's of fat with the gland behind the nipple, so your breast volume is larger. So we almost always leave drains for grade 3 because the risk of seroma is almost guaranteed. So by leaving drains, it greatly decreases the chance of having the risk of seroma. So we remove those in general within 2 to 3 days after surgery. If you're out of town, you definitely remove those before you leave. So there's that. Okay, I think I covered the general, that's my general speech for all my consultations that I give for patients when they come see me either virtually or in the office. Now, to address some of the more common questions that I get. Now, one of the most common questions I get is, do I remove 100% of the gland? That's probably the most common question I get. And yes, I do. I definitely remove 100% of the gland. I don't leave anything behind. You know, the question is why. You know, a lot of surgeons. First of all, I do a lot of revision surgeries, unfortunately, because you know, there's a belief out there that surgeons leave, a lot of surgeons leave a little bit of gland to provide support of the nipple to prevent caving in or the nipple to like dip in. So they leave a little bit of gland to provide that support, so you don't get that effect. Okay. The problem is you leave gland behind. And when you leave gland behind, the potential for the gynecomastia to come back is there. And it definitely does come back. It's just a matter of, in my experience, it's just a matter of when. Sometimes, you know, I've done gynecomastia surgery revisions probably, you know, I think as early as 6 months after the gynecomastia surgery. You know, that's a little bit unique when patients are on testosterone replacement therapy. But, you know, we've had guys, you know, they had surgeries 4 years ago or 5 years ago, and their gynecomastia came back. So definitely removing 100% of the gland is important. Now, how do I prevent the indention part that everyone talks about? So there's 2 things. Number 1, aggressive liposuction. You have to to prevent that dip, you have to do aggressive liposuction around the nipple area so that everything stays nice and even, so you don't get that caving in. Because the reason why you get that cave in is because the surgeons don't do liposuction around the breast gland. They just remove the breast gland, they don't do liposuction around it. So obviously you get that cave in. It's like removing the top of a mountain but not removing the base. So you leave a base, it's kind of like a crater. So you'll get that crater effect. So you definitely have to be aggressive about doing the liposuction around it so you don't get that cave in, number 1. Number 2, it's the massaging. So you have to make sure that you treat that scar tissue around, so you don't get like scar tissue build up around the nipple, and then the skin around it builds up with scar tissue, and the nipple itself sticks down. So you have to massage so that you don't get that problem as well. And so that's why I'm aggressive about starting massaging 2 weeks after surgery. So those two things are important to do to prevent that cave-in. And that's why me, and as well as other gynecomastia surgeons who do a lot of it, remove 100% of the gland, because we know that gynecomastia does come back, definitely, okay? Let's see, another question. I had a bunch of questions emailed to me or texted to me. Also the exercising. So my protocol is like, when can I start exercising? And I have my guys start exercising 2 weeks after surgery. So I generally tell guys no cardio back, chest, and overhead pressing 2 weeks after surgery. Okay, and the reason why is because it'll increase swelling in the chest if you do it too early. However, I want you to do exercises, those chest back 2 weeks after surgery, because in my experience, it helps with the scar tissue, number one. It helps skin contraction, and it helps range of motion. Yeah, I know there's a lot of surgeons out there. It's like you can't, you shouldn't work out for 3 months after surgery, or 6 weeks after surgery, 8 weeks you can move the results. I find that that's not really true. I used to be one of those guys. I used to say, don't work out for 8 weeks after surgery. You could run, and but if you look at the literature and you actually look up the research, there's actually no evidence that shows that holds true. So for me, you can work out stomach, legs, arms, butt, neck next day if you're up to it. But chest, back, and cardio, you have to hold out for 2 weeks. And then after 2 weeks, I want you to be aggressive about incline chest pressing, pectoral flies, lat pull downs, and rows, and that will actually make your post-operative result look better. If you're committed to surgery with me, I tell guys, hey, if you're gonna do surgery with me, I want you to start doing those exercises now, because after surgery, your final result is gonna look awesome right away. So the earlier you start those exercises, the better. It's not going to make my surgery easier if you work out for 3 months building those muscles. It's not going to change anything from a surgical standpoint, but from your aesthetic standpoint, after the surgery is done, it definitely you'll be happier with your final result a lot faster, because you'll have already built up a foundation of your underlying muscle. Because I can't do anything about your musculature. I can't do anything about your muscle, but I can definitely do something about your gynecomastia and the surrounding fat. I can't do anything about building up your muscle. Well, I can technically, but nothing surgical. All right. We don't do pectoral implants. Number one, because it doesn't look natural. Number one, and I just philosophically I don't like doing it, because I like to do I also do a lot of testosterone replacement therapy. I like to do health. I like do health promotion and stuff like that. So I don't like doing pectoral. I don't like doing pectoral implants personally, and I'm not a big fan of fat grafting either, because it's temporary. Number one. Number two, it's dangerous. You can get fat embolism. Number three, it doesn't look natural, and especially with the technique that we use, it makes your muscles look puffy. It doesn't make them look hard and defined. So I'd rather work with my guys post-operatively to get their chest looking a little bit more hard, a lot more defined, rather than looking more like puffy and pillowy. And again, it's temporary, because your muscle will eventually absorb it. And number two, most importantly, it's potentially dangerous. You can get fat embolisms from that and stuff. There's been reports of that, and again, my priorities are safety, and I don't want to do anything. I don't want to do anything that will put you at extra risk. Okay. Which kind of leads me into the reason why I went into gynecomastia, and I'm sure everyone here, the reason why you're interested in gynecomastia is not so much, well, yes, it's because of the aesthetics part of it, but more more of it is because it's causing you anxiety. It's causing you, it's hurting your self-esteem. It's giving you a problem with your self-confidence. You're not, the 99.9% of guys, when they talk to me, they don't come to me because they say, I want my chest to look better. They usually say that it's hurting my self-confidence. It's, I just don't feel comfortable taking my shirt off, or, when I hug somebody, I just don't feel comfortable hugging someone because I'm worried that they'll feel my chest, or, when I'm with a girl or with my girlfriend or with my wife, I can't turn the lights on because it's just stresses me out. It's not because I want my chest to look more muscular. That's never the reason. The reason is because it's, it hurts my self-confidence. So that's why I don't like doing pectoral implants, and that's why I don't like doing fat grafting, because it doesn't really accomplish the goal of why I went into it, is because it's more of a mental treatment and a physical treatment. It's a mental treatment as well as a physical treatment. That's just not my goal for why I do this, all right? Okay, another question is, I hate answering this question, but I get this question, unfortunately, a lot, is why should I go with XSculpt instead of like someone like Dr. Leibowitz or Dr. Caridi? Why should I go with XSculpt? There is actually no reason that I can really, I've seen Dr. Leibowitz's results, I've seen Dr. Caridi's results, I've seen a lot of, Dr. Delgado. All those guys have great results. I've seen the results, and those guys do great work. I think they do great work. I think what it really comes down to is when you choose your surgeon, you got to be happy, you have to be comfortable with who you go with. Obviously price is a key factor. I think what really comes down to is your comfort level with your surgeon, which is most important. You look at the before and afters. It's very important that you meet with the surgeon, you talk with the surgeon, your surgeon has good follow-up care, and I think that's what's more important. Is my results better than Leibowitz? Is my results better than Korea? To be honest, I don't think so. I don't know. I think, to be honest, I think we all have this. I think we all have the same results. On all our before and after galleries, nobody posts bad results on their before and after pictures on their galleries. Nobody will post their bad results. Nobody will post their complications. Nobody's gonna post their bad reviews. As soon as one of those goes up, it gets deleted right away. No smart surgeon would put that on there. So it's very biased to do that. So it's very hard to do it that way. But like I said, I think it's important that you meet with your surgeon and that you're most comfortable with them, because that's actually what's most important. Because God forbid something go wrong and you need someone to talk to, or if you have questions, you want to be able to talk with your surgeon, and maybe not somebody like a secretary or a nurse, or just like a second party individual. You want to talk to the guy who actually did the surgery, who actually was in your chest and stuff like that, right? So you're paying a lot of money for a procedure. I think that the level of care that you deserve is, you should be the top level of care that you deserve a top level of care. And so you should have direct access to the surgeon. That's what I would want. And so I think that's what's most important. So, to that end, for my patients, all my patients get my personal cell phone number. I don't have two phone numbers. I only have one. So all my patients get my cell phone number. They get my, they can text me at any time. I'm never off the clock. You might text me at 2 a.m. I might not return that one, but I'll do it as fast as possible. And then I don't know. I think I'm proud of my postoperative care with my patients, and feel free to ask any of my. If you guys, well, obviously this is just a Reddit. This is exclusively for Reddit people. So if you ask some Reddit guys who's been with me, please ask them about their experience with me, and whatever they say, with their experience with me is what's important. That I think that's probably best way to do it is if you ask for maybe referrals from previous patients. That might be the best way to do it. You know, like reviews, again, the problem with the reviews is they only post the best reviews. No one will post the bad reviews. So it might be a good idea to just maybe reach out to patients. That's what's great about Reddit, is because Reddit will post everything. You know, patients who had great experiences or bad experiences, they'll post their experiences. So and it's brutally honest. So that's what's the nice thing about Reddit, is that it's unfiltered and uncensored. So if they have a bad experience, you'll see it. If you have a great experience, you'll see it. So that's a good thing. So I think that's what's important, is that you're happy and you're most comfortable with who you choose. Okay. So I think that's why, and I think that's why that's why I don't feel comfortable answering of that, because I don't think that it's kind of a fair answer, because anything I answer would be biased. However, I do testosterone replacement therapy. I do help maintain weight loss with patients afterwards, and I help. I do help. Patients, unfortunately, afterwards, when they gain weight after surgery or they need help maintaining their health. XSculpt does provide like a full health and hormone panel afterwards. So after their surgery, we also provide, ways to, let's say for example, you have low testosterone, or growth hormone's low, or your vitamins all messed up, or whatever. If you're looking to do a whole body transformation, just health-wise, that's something we can assist you with if it's something you're interested in. And there's no obligation. We do a free consultation for your full health and hormone panel, and you can take that information. We do a free consultation. You can take it to your primary care doctor. You can take it to any provider in your area if you don't live in Chicago, or if you live, we do it remotely, but you can take that information and do it on your own, whatever you want. What I want is to make sure that you're just educated and you're healthy and you're happy, and that eventually that you can take your shirt off at the beach and not worry about it, and you can be with your partner with the lights on and not worry about it, and you can wear tighter shirts and not have to wear hoodies everywhere. That would make me happy. So either do it with us or with anybody else, if you can get to that point, I think that's considered a success. Okay. That being said, I think that would pretty much conclude this session. I will post this on YouTube. The session on YouTube. I'll post it on Reddit, but I'll post a link on Reddit, and then I hope everyone who joined us learned something. And please, if you want to ask a specific question for yourself, please, you can email me your pictures directly to my email. It's Dr. Adajar, Dr.Adajar @xsculpt.com. Or if you want, you can text me at my cell phone is 847-858-6432. That's 847-858-6432. You can text me directly your pictures if you'd like, or you can email to me, or you can go to our website and there's a virtual consultation tab. You can upload your pictures or whatever. Our consultations are free. And then please just mention, that you're on this Zoom thing, the Zoom, and we'll apply our discount to you. And then I really hope you enjoyed spending time with me, and then I hope to see you soon. All right, thank you. Bye.